Hi, folks. Dr. Brian Quebbemann here. This brief video is something that I feel strongly about, and it really has to do with the ethics in the medical profession. And what I have to say about weight loss and weight control in the medical profession is shame on medical doctors, shame on the medical profession. And I'll give you the reason that I say that. Weight loss is now big business, but it wasn't always that way. In fact, weight loss, and I'm taking a look at some of my notes because this is a pretty serious topic and I don't want to get it wrong. Weight loss was, in my opinion, the most ridiculed field in medicine up until about 10 years ago. And many doctors were laughed at and told they were charlatans and clowns because they did weight loss. Now, I trained at some really outstanding places. The University of Minnesota was one of the best places in the world to become an academic surgeon, and that's originally what I wanted to do. I chose not to do that because I actually didn't want to treat trainees as hard as I felt I was treated during my residency program. I did learn how to do surgery, and maybe that was what was required, but the fact is that was the decision I made at the time. Nevertheless, my pathway to weight loss and metabolism and fitness as a field is a little bit unique. The medical school that I trained in was the first place in the world to publish a study on weight loss surgery. A man named Dr. Richard Varco, who was a very famous surgeon who actually was involved in the first open heart surgery in 1952, performed in 1953 an intestinal bypass for weight loss, and he published that. Then in the 1960s, somebody joined the staff. It was Dr. Henry Buchwald, MD, PhD, and he was a very brilliant bariatric surgeon. And he did bypasses of the intestine for high cholesterol and high triglycerides. Now, the high triglyceride situation is at the time, and to some extent still, is not treatable without surgery. And the surgery was extremely effective. When I was in medical school, he published a paper in the New England Journal of Medicine called the POSH study, P-O-S-C-H. You can go look it up, Dr. Henry Buchwald, about how jejunal ileal bypass had dramatic results in improving people who had very high cholesterol or very high triglycerides. When I was in medical school, the first weight loss surgery I saw was a gastric bypass. And that was in 1990, so that's now quite a while ago. And that surgery was done by Dr. Henry Buchwald. Then at the University of Chicago, there was a professor there who trained us in bariatric surgery, and I paid attention because I was already interested in it. And so when I got into my practice and started my weight loss surgery practice, you can imagine how baffled I was at the beginning to find that the overall impression among the medical profession, at least throughout Orange County, but from what I could tell throughout the United States, was that weight loss as a field was a joke. I was laughed at. People criticized me routinely. I almost never got a referral for weight loss surgery at the beginning. Now, you have to understand that nearly 40% of American citizens at the time were obese, and 5%, or 1 in 20, of American citizens at the time morbidly obese, okay? So those people, or worse, super obese, very severely obese. So those people were candidates for weight loss surgery, and weight loss surgery was the only thing that had a very high cure rate, and if done correctly, had a low complication rate, yet I didn't get any referrals. So if you look at Orange County alone, there's almost 3 million people in Orange County. And so that means that I had, I don't know, let's just say 10% of those people were candidates for bariatric surgery. You'd think that I got a lot of referrals. You'd think that I would be having to beat patients back at the door because I just didn't have time to see them all. But no, it was like pulling teeth to get referrals. Doctors would tell me, hey, Brian, why are you doing surgery for a bunch of crazy people who just need to put the fork down? I gave grand rounds. I was actually told that by an obese physician sitting in the center who I found was somebody who had been the chief of staff at the hospital I was giving grand rounds at. And he laughed and said, you should just tell him to put the fork down. And I looked at him and I said, well, your body mass index is about 35. So what should you do? Should you just put the fork down? I mean, I was kind of pissed off. That made him mad and embarrassed. But hey, I was the one giving the talk. And he had said something so profoundly stupid that it really did piss me off. So anyway, That's what I ran into. Nevertheless, I persisted. I knew that the people I trained with were right. I knew how to do the surgery. And over time, I built up a reasonable surgical practice doing weight loss surgery. But I also always did non-surgical weight loss. So, and you can see it right here. This is high impact weight loss. It's part of my non-surgical weight loss program. It works great. It's a very rapid diet. And then you transition using the dietary rebuild, which is a protocol I came up with that really works for transitioning to get people off of a diet onto a stable weight without having to stay on a diet for the rest of their life. So anyway, that's what I did. And I'm still practicing. Okay. But it was well known at the time that weight caused diabetes, caused heart failure, actually increased your risk of cancer. So what was the problem? How come I wouldn't get any referrals? I had a non-surgical weight loss program. I had a surgical weight loss program. I had a psychologist if patients needed to talk to psychologists. Most people just got an evaluation and they really had no psychological issues. They had just gained weight over time. And so there wasn't like these people didn't have a psychological problem that was any different than anybody else in the community. They had just gained weight and now they needed to lose it. So that's the way I approached it. And yet, with all of this evidence that is out there in medicine that obesity causes all these problems, I didn't get almost any referrals, very few referrals. Now remember, there's probably 300,000 people who qualify for surgery, not just weight loss, but surgery. 40% of people were obese. So if you say there's 3 million people in Orange County and 40% are obese, that's 1.2 million. And yet I wasn't getting referrals from physicians. Now, all of this completely changed when the GLP-1 medications came out. If you look back at 2017, which is 9 years ago, not even 10 years ago, 23% of patients with obesity that asked their physician to help them with obesity were given advice and given a second appointment to talk about it. So most of the people, when they asked, the doctor would only talk about it once, but wouldn't bring them back. There would be no follow through. 23% by one study got a second consultation. That's it. Less than a quarter of the people who asked about it. Okay. So the other problem was it's almost impossible to get the insurance companies to pay for obesity. And now maybe that's changed, but you have to sort of jump through hoops to get them to pay for obesity. If you have diabetes or hypertension or something else, they automatically pay for that consultation. Obesity, which causes all these problems, they won't pay for. And you don't see a big battle by the American Medical Association or the medical community at large saying, hey, that's wrong, you should pay for it. No, they really don't care. So along come GLP-1s, and all of a sudden, weight loss is big business. And all these doctors care about it. Do you really think that all of a sudden compassion has erupted or empathy? They can feel what obese people feel now, and so they're now willing to help? Or has Novo Nordisk, the company that came out with Ozempic and came out with Wegovy, and so they said, okay, we have the GLP-1s and they work for weight loss. Have those companies spent a lot on marketing? Well, maybe. Novo Nordisk has become the single biggest corporation in Europe based on GLP-1 medications. Okay. The valuation of that company went from roughly $250 billion to over $500 billion in about 2 years. Now, there are a lot of executives showing up with new Porsches, I can tell you that. Do you think the company is spending a lot of money on marketing? I don't know. I opened up the web the other day to read the news, and in scrolling down, there were 13 ads on GLP-1 medications. So it's big business, no question about it. Now, the drugs work fairly well, but here's the catch. About 40 pounds of weight loss or less, that's the majority of people that are taking GLP-1 medications. They need to lose less than 40 pounds. If they did this high-impact weight loss, I guarantee they'd be successful, okay? They'd be successful without the drugs. In a year, they would lose the 40 pounds or the 30 pounds or whatever. They would transition off and they would be successful. But the doctors are just writing prescriptions. Why? Because people pay cash. Okay. Does that sound like empathy or compassion or anything else? No. Shame on the medical profession. Shame on the healthcare system for setting this up and pretending that they care. So What about the people that are severely obese, morbidly obese, super obese? Oh, they're not getting anything. Most of them can't afford the GLP-1 medications, and they really don't work well enough for somebody who has a BMI of 50 or 55. And I can tell you, I've operated on a lot of people. The biggest BMI I've ever operated on that came in my clinic was 111. Do you think that a person with a BMI, body mass index of 60, which means they're roughly 2.5 times their healthy weight, 2.5 times. Now, that's not muscle, that's body fat. Do you really think that GLP-1s are going to help that person? Not a chance. Now, with all this awareness, all this compassion and empathy that's out there for people that have obesity or excess weight, because, oh my gosh, we're writing prescriptions for GLP-1s right and left. Do you think that there's more referrals for people that meet the criteria for bariatric surgery or less? Obviously, there's less, okay? So the compassion hasn't changed. The system hasn't changed. The doctors really don't give a rat's ass about obese people. They're still in the mindset, just put the fork down. It's maybe changing, and I hope it is, but if it's changing very slowly. And I can tell you, all the people that I know, a lot of the healthcare experts that I know, that advocate for GLP-1s, they haven't even actually practiced. They might be a dietitian. They might be a nutritionist that help a drug company come up with some drugs for weight loss, or a diet company come up with a diet, or some nutritional product line or something like that. Oh, and they're saying, oh, everybody should be doing this, everybody should be doing that with the GLP-1s, but they've never treated anybody. They don't run a clinic. I've been running a clinic for 30 years. I've dedicated my life to treating these people, and I can tell you that the medical profession and all of the healthcare industry out there really doesn't give a shit. They still don't care. They pretend they do because they can write you a prescription and send you on your way. If you look at the company's instructions, they say these prescriptions work best with concentrated change in your diet and a regular routine exercise program. Now, that is true. If you take the drugs and you do that and you follow it, they will work. Pretty good drugs, actually. I prescribe them. But this video is talking about the overall image of the medical profession all of a sudden caring about obese people. And I can tell you, they don't. So I'll say it once again. Shame on the medical profession. It's embarrassing to me to have people so biased against a large group of the population. I hope everybody is aggressive about going out and finding somebody who cares, whether they help them in a medical weight loss clinic, or you see a bariatric surgeon, or you follow up with a well-informed dietitian or something. And I hope they actually really do care and they try to do the right thing. But this has been a pet peeve of mine for a long time. I'm going to talk about in the future what steps you need to follow in order to be truly successful with GLP-1 medications. A lot of people are just taking the shot. They lose their 20 pounds. They're barely exercising. They don't really change their diet. They eat less, but they eat the same diet. They just eat less of it. It wasn't healthy before they started the GLP. It's still not a healthy diet. And they're starting to get malnutrition while they're on these medications or other hormonal abnormalities. So I'm going to be talking about that in the future. If you do it right, the drugs will help and they'll work. If you are morbidly obese or severely obese, they probably won't work as well as you need them to. And what you should do is probably consider bariatric surgery. I hope this kind of clarifies some stuff. And the company that came out with the Wegovy, Ozempic, is now absolutely wealthy, profoundly wealthy. Do you really think all these ads with superstar athletes relates to you? I don't really think so. So be careful what you do. If you're going to do it right. And good luck. All right, everybody. All right. Have a good day.